And Stuart McMillan.
Thank you, Presiding Officer, to ask the Scottish Government what discussions it has had as part of its cross-government coordination of COVID recovery policies regarding the wider impact of long COVID, including on the economy and workforce.
Cabinet Secretary.
Presiding Officer, the Scottish Government recognises the impact that long COVID can have on the health and well-being of those affected, including on their ability to stay in employment. While there have been increases in the number of people who are economically inactive due to sickness since before the pandemic, the extent to which this is attributable solely to long COVID is not yet clear. We are investing in scientific efforts to understand and treat long COVID, and we have made funding available to NHS boards and partners to deliver the best local models of care for assessment, diagnostic tests and support for ongoing management or treatment of symptoms. Through our Fair Work agenda, we are also explaining to and supporting employers so they can support workers living with long COVID to remain in employment.
Stuart McMillan.
I thank the Deputy First Minister for that reply, and I'm concerned that people with long COVID may find themselves locked out of employment if they are not given the adequate support to return to work. This is especially true if the person's job cannot be done from home, such as nurses, for example. Can I ask then, what is the Scottish Government strategy to actually help ensure that people working within our NHS who are suffering from long COVID are supported to return to work where possible, and where they can't return to work, other options are explored to help them stay in employment?
Cabinet Secretary.
There's a priority across the whole of government for us to maximise the available level of participation within the labour market. We want to maximise the number of people who are available to actively contribute to the labour market. As I said in my response to Christine Graham, we have low levels of unemployment and high levels of employment, and the labour market is very tight. So encouraging people who have long COVID to be able to return to work through all the necessary clinical support and mental wellbeing support and any other assistance that is required should be available to them. And if there is a case for individuals to find alternative employment, we should be open to providing the training and the skills enhancement activity that will support them in making that transition.